Switch gears right now here at 9:14 because here in Charlotte, the Charlotte-based organization, nonprofit Camino, is launching North Carolina's first ever peer support specialist certification training that's offered entirely in Spanish. A need here that is definitely feeling the impacts in the Spanish-speaking community, and it comes as the state faces a critical shortage of bilingual behavioral health professionals as the Latino community is experiencing increased mental health needs. So, joining me here in studio right now, let's give us a warm welcome to David Villanueva. Buenos dias, David. How are you?
Hola, buenos dias. I'm doing well, thank you.
Hola,
Thank
hola.
you for having us here.
Oh, absolutely. So let me get my notes out here because that sounds kind of alarming, right? That there is a need, that need for mental health for the Spanish-speaking Latino community is increasing, one. And number two, that we need more mental health professionals that are capable of helping the community. Tell us about the need first in this community.
Yes, so great question, and thank you. One of the things that we do know is happening here in our state or in North Carolina is the Latino population is growing at one of the fastest rates around the country.
Right.
Multiple reports from NCDHHS, NC Department of Health and Human Services,
Right.
also with a study run through Camino, through our research institute, a strength and needs assessment that was done of the Latino community in North Carolina, has indicated that there is a growing concern over mental health challenges and issues. And there's also one of the barriers for individuals that are seeking help is the lack of bilingual, or more specifically Spanish-speaking providers in our communities.
All right, so let's talk about what is offered there at Camino anyway for helping individuals with their mental health needs.
Okay, so through Camino, specifically dealing with mental health, we do offer services geared, under the umbrella of therapy and counseling. We also offer pastoral counseling. And one of the additional services where I work is we do offer peer support.
Oh, okay, very good. And then so what does peer support look like? And what are people coming in with their needs?
Okay, so peer support is on a most basic, simple level is individuals with lived experience facing a mental health challenge and or substance use disorder who help other people navigate these same types of challenges or experiences that they're living with. A peer support specialist, so we can define that.
Yeah.
A certified peer support specialist is an individual in the state of North Carolina who has met the requirements for certification. To become a peer support specialist in our state, you do need to have be in recovery and have lived experience with a mental health challenge and or a substance use disorder. And you use that experience to connect with other individuals and then to offer assistance and, like we said, to navigate these challenges and the improvement of their overall mental health.
Isn't that so important, is to have someone that is able to relate with the experience of people who are struggling these days and be able to walk with them and meet them where they are because you've already walked that walk too, right?
Yeah, definitely, exactly. Lived experience, as maybe through your own personal life and experiences, allows you to connect with other individuals in a way that you can't do it through schooling, through any kind of education or training.
Sure.
Lived experience is unique. It allows an individual to build a relationship with someone else through that common understanding.
So let's talk about the actual certification training, because now we know that program is there for you, peer support at Camino, but also the training. If you can offer yourself and give back, what does this training look like?
Okay, so the training that we have through Camino, A Path to Recovery, in Spanish, Un Camino a la Recuperación, meets the requirement. It's a 50-hour course that meets the requirements of North Carolina to obtain your certification in the state. Training is a 5-day class. It is 50 hours. 40 of those hours are spent in the classroom setting through one-on-one, or not one-on-one, but in the classroom setting with a live instructor. The other 10 hours are composed of some pre-work and homework that individuals would have to do. The class itself as a whole is built on the concept that there is no right way or wrong way to recover. We have to define what recovery is.
Right.
Recovery is an individualized, personalized journey of transformation and healing. The other definition that we use is the one from SAMHSA, which is that recovery is a process of change where an individual improves their health and well-being, lives a self-directed life, and strives to reach their full potential.
Fantastic.
So using this definition, we see that individuals can be in recovery for a multitude of challenges that they may be facing. Our course specifically educates individuals on the concepts of peer support, on what recovery is and isn't. It teaches individuals how to build healthy relationships in all aspects or all parts of their life. And then we do cover things of how do we deal and assist people who may have experienced trauma in the past. We identify recovery tools. It's all evidence-based practices.
Right.
Right? The
Yeah.
book is built on evidence-based practice, so we know that the tools and the methods that we're using in our course have been proven to work. And peer support in itself is an evidence-based treatment model. We understand that, yes, it works. When individuals engage with a peer support specialist as part of their recovery journey, the chances of long-term or sustained recovery greatly increase. So individuals that come to our class, it's a 5-day training. We go through the process. Because it is geared in Spanish, and since we've identified the need that we do need more Spanish-speaking providers, and specifically mental health providers in our community, it provides a track where individuals who want to assist others or maybe start work in that mental health field and profession have access now. I want to make it clear that it is not for only Latino individuals, but for Spanish speaking, anyone from any culture or background, as long as
You can
you
speak
speak Spanish, you learn how to provide peer support. You learn the peer support concepts in Spanish and how to deliver peer support to the Spanish-speaking community.
Oh, muy bien. If my Spanish was better,
Gracias.
I'd be,
Lo podemos practicar. Si
I
quieres.
know, necesito practicar as well. So, David, how do people get involved and get more information?
They can contact me directly. Best way to contact me is through my email. My full name is David Villanueva. My email is David, David, @camino.org.
Perfecto. Perfecto. David. Señor, excelente. That was well done. Thank you very much, and really shining a light on something that's needed, but that is also offered to both the recipient and the peer support specialist and our future peer support specialists who are bilingual. A great service that you guys provide. So thank you for coming in and talking about that.
Thank you for having us.
Appreciate that. David Villanueva, reach out to him or Camino if you want more information. All right, we're going to take a quick break. We have another special interview coming up here, more on the health front as well. All right, so we'll talk about that in 2 minutes. You're watching Live Impact News on WCNC+.